National Registry of Emergency Medical Technicians. Advanced Level Psychometer Examination. Supraglottic airway device. Note, if candidate elects to initially ventilate with BVM attached to reservoir and oxygen, full credit must be awarded for steps denoted by ***, so long as first ventilation is delivered within 30 seconds. Takes or verbalizes appropriate PPE precautions. Opens the airway manually. Elevates tongue, inserts simple adjunct, or a pharyngeal or nasopharyngeal airway. Note, examiner now informs candidate no gag reflex is present in patient accepts adjunct. ***, ventilates patient immediately with bag valve mask device unattached to oxygen. ***, ventilates patient with room air. Note, examiner now informs candidate that ventilation is being performed without difficulty and that pulse oximetry indicates the patient's blood oxygen saturation is 85%. Attaches oxygen reservoir to bag valve mask device and connects to high flow oxygen regulator, 12 to 15 liters per minute. Ventilates patient at a rate of 10 to 12 breaths per minute, one ventilation every 5 to 6 seconds, with appropriate volumes. Note, after 30 seconds, examiner auscultates and reports breath sounds are present and equal bilaterally, and medical direction has ordered insertion of a supraglottic airway. The examiner must now take over ventilation. Checks/prepares supraglottic airway device. Lubricates distal tip of the device, may be verbalized. Note, examiner to remove OPA and move out of the way when candidate is prepared to insert device. Positions head properly. Performs a tongue jaw lift. Inserts device to proper depth. Secures device in patient, inflates cuffs with proper volumes and immediately removes syringe or secure strap. Ventilates patient and confirms proper ventilation, correct lumen and proper insertion depth, by auscultation bilaterally over lungs and over the epigastrium. Adjusts ventilation as necessary, ventilates through additional lumen or slightly withdraws tube until ventilation is optimized. Verifies proper tube placement by secondary confirmation such as capnography, capnometry, EDD or calorimetric device. Note, the examiner must now ask the candidate, how would you know if you are delivering appropriate volumes with each ventilation? Secures device or confirms that the device remains properly secured. Ventilates patient at proper rate and volume while observing capnography/capnometry and pulse oximeter. Critical fail criteria. Failure to initiate ventilations within 30 seconds after taking body substance isolation precautions or interrupts ventilations for greater than 30 seconds at any time. Failure to take or verbalize appropriate PPE precautions. Failure to voice and ultimately provide high oxygen concentration, at least 85%. Failure to ventilate the patient at a rate of 10 to 12 breaths per minute, one ventilation every 5 to 6 seconds. Failure to provide adequate volumes per breath, maximum 2 errors/minute permissible. Failure to pre-oxygenate patient prior to insertion of the supraglottic airway device. Failure to insert the supraglottic airway device at a proper depth or location within 3 attempts. Failure to inflate, cuffs properly and immediately remove the syringe. Failure to secure the strap, if present, prior to cuff inflation. Failure to confirm that patient is being ventilated properly, correct lumen and proper insertion depth, by auscultation bilaterally over lungs and over the epigastrium. Insertion or use of any adjunct in a manner dangerous to the patient. Failure to manage the patient as a competent EMT. Exhibits unacceptable effect with patient or other personnel. Uses or orders a dangerous or inappropriate intervention.